Looking younger, I'm in. Dr. Diepenbrock is the guy to see. He's here to tell us about how to get that facial rejuvenation without an old school facelift. So Dr. D is always on the cutting edge of facial technology, of all the new stuff. So tell us, what is the latest procedures or options in facial rejuvenation?
Well, the latest thing that we just incorporated in our practice is something called Embrace RF. And what that does is uses radio frequency to help dissolve fat and simultaneously tighten skin. It's a great alternative. It's something that's done in the office relatively quick, a lot less downtime than a facelift, and for the right patient can give absolute fantastic results that we've really never been able to achieve before.
So who is the right candidate for this procedure?
So really we're looking at that younger patient who maybe wasn't quite ready for a facelift, has a lot of excess tissue, maybe some jowling, some fullness here in the neck, and we're able to do this and really get them really natural results without something really big. So we're looking at, maybe our mid-20s up to mid-50s, and we're getting awesome results in a fraction of the time and a fraction of the downtime.
I love the fact that you just said younger patient and you included mid-50s into that. I appreciate that.
Of course.
Thank you.
It's for you.
I really do appreciate that. You said that this downtime is much less. So what are we talking? Like, would I need like weeks off of work after having something like this done?
Absolutely not. I've done it on a number of my own employees, my own assistants, and usually they're back to work in a day or so. So I want you to take at least the next day off just to recover, because there's usually some anesthesia involved, but you're feeling pretty good day 2 after the procedure. I like you to wear a little compression device to help hold everything nice and tight. But other than that, minimal bruising, minimal swelling, and then it just gets better and better and better over time.
You mentioned a little anesthesia. Walk me through like what it's like. Am I awake? I mean, is it like conscious sedation? Am I awake at all? What's the pain like?
Sure.
You know how I feel about pain.
Absolutely.
What's it like?
So the neat thing that we can offer is, unlike a lot of other providers, we can do our own anesthesia. So we will do a sedation. Depending on the patient's comfort level, we can turn things up and down. Some patients don't want to have any anesthesia, so we may give a little pill to help cut off some of the anxiety. But I would say probably 90+% want a little something to cut the edge off.
Sure. I want a lot of something to cut the edge off. Give it all to me. What kind of, if we're talking about small things done to full, complete facelift, like where does this go in that spectrum of
So the
procedures?
The patients who have excess fat, that fullness under their neck or in their jowls, but the skin is relatively good and the muscle is good. We do 3 teeny tiny incisions here, go through, dissolve the fat, remove it, and then go over top of it with another device and tighten the skin simultaneously. Where somebody who has a lot of excess skin, a lot of muscle laxity, they may have to go to that bigger type procedure.
Well, this is a perfect time. It's relatively little downtime, but this is a perfect time to cut, minus this weekend when it's just gross outside, to take a couple of days off and relax at home. So now is the time to call. I would also suggest following them on Instagram, because I do, and you see some amazing before and after pictures. Well, call today, call and schedule your appointment, 436-NEW-YOU, that's 6898. We'll be right back.